So another condition noticeable straight after birth is developmental dysplasia of the hip. This is when there's an abnormal hip joint leading to instability and dislocation. So because of this hip instability, the femur is actually outside of that hip socket and positioned higher than normal. This causes the affected leg to appear shorter, and we will see asymmetrical thigh skin folds. So one side, the affected side, will have more skin folds than the other. We'll also see positive ortolani and Barlow maneuvers. These are tests that the provider does to test hip stability in newborns. So what the provider does is they flex the infant's knees towards their chest and then pulls them apart and pushes them back together. If you see any hip dislocation or clicking, that can indicate hip dysplasia. For infants with hip dysplasia, we need to prepare to teach caregivers about Pavlik harness use. This is a device worn to promote that hip stability. So a memory trick, remember the capital H in hip, that is the position that you want those legs. So keep the legs flexed with the hips apart, and that looks like a capital H. So under the harness straps, we need to worry about that skin. So we need to dress them in clothing like a t-shirt and diaper to protect the skin from the rubbing of the straps. We also need to avoid applying lotions or powders because that can cause rubbing and maceration and damage that skin. We also need to massage skin daily to promote circulation. And remember, any client wearing a device, we need to always assess skin integrity and monitor circulation. So for older children and infants with this condition, they will need to undergo a surgical hip reduction and need hip spica casting.